Hopefully you got that first time round. And now I know a lot of you will already know us, or will already have spoken to us, or linked in with us, or something. And you probably know we work for Paycare. Some of you may not even have heard of Paycare before. We're going to try in the next 10, 15 minutes, however long we get, is to try and make, like I said, employee wellbeing sound really sexy. And really, moreover, just to make you start thinking about employee wellbeing, what that means to you, what it means to your company. I know we've got some small businesses here, but that's kind of what we're aiming to do here today. A bit of a double act, so.
I'm definitely winging it, actually. I
We're
found
all
out I
winging
was doing this yesterday, and I was like, Steve, can you jump in for Simon instead? And I was like, oh, okay. So let's just learn what this presentation's about.
And I'm winging it because I was going to run through it this morning, and I got called into a meeting, and hey, just didn't have time to do it. So, sorry, apologies if we look completely unprofessional. So, who are we? 150 years of Paycare. Well, we are 150 years old. No, not even jointly together, but the company itself is 150 years old. We didn't start out as Paycare. What were we?
Patients Aid Association, back in 1874.
Exactly at the same time as Darlaston Town, hence the connection, which is rather nice. So we celebrated our 150th year last year, as did Darlaston. And actually, this little picture here was taken at a fun day that we had here in the summer. Was it in summer? Yeah, September. We had an absolutely beautiful day here. Did a bit of a joint celebration with the club, which was absolutely fantastic. Raised a little bit of money for some charities, which was even better. And this is kind of, sort of what we look like. Not quite how we look, but sort of. So yeah, Stephen's going to tell you a little bit more about what we actually do when we get to it. But you'll obviously have gathered it's something to do with employee wellbeing. So, but because I've got the graveyard shift here, and because it's hot out there, and because you're all full now, we're just going to have a bit of fun and a bit of participation. Not too much, it's not too scary, but a little bit, okay? So, I can't hardly read that. I thought that would be a big, but apologies for that. All we're going to do is have a show of hands. It's quite easy, as to whether you think it's fact or it's fiction. Hopefully, if I can get it to go on. Okay, so signs of burnout are becoming more common, with 63% of the UK employees now showing symptoms like exhaustion and disengagement, which is up from 51% 2 years ago. Do we think that that is fact or fiction? So, if we think it's fact, hands up. Oh, that's impressive. Everyone's awake. Yeah. That is impressive. Right, okay, let's have a look.
That was the impressive part.
That was the, oh no, that's what I meant. That was the impressive part. Yeah, you're right, it is. Okay, that's absolutely right. So we're all obviously in here, half of us are at least exhausted. Exhaustion, disengaged. Actually, we've obviously not got that. Okay, next one. In 2019, remember that was COVID time, 25% of respondents had a wellbeing strategy in place. In 2024, this had increased to over 65%. Now, this is from one of the surveys done by the Black Country Chamber. Tell me what QE stands for.
Quarterly
Economic Survey. Always forget that. Okay, so that's in the Black Country. So that's, you know, us guys essentially. So do we think that that is fiction or fact? Shall we go? Who thinks it's fiction? Oh, okay. So the rest of you, I'm assuming, have either fallen asleep or we think it's fact. Yeah, okay. So we'll look then. Actually, it's fiction. So actually the figure is up, but only to 50%. So well done to those guys in the room. No prizes, unfortunately, but yeah, 50%. But think about that. That means half of this room, no wellbeing strategy in place where we work. Half of us. Which half? This half, right? Poor old you. You're okay. Yeah? So, yeah, 50%. Not great really, is it? I don't think. We think it's great? 2023, sorry, a couple of years old, I know, but UK businesses are estimated to have lost 56 billion due to employee absenteeism, and that includes lost productivity, cost of sick pay, and the burden of covering for absent employees. And I'm quite sure, even though I know a lot of you are quite small businesses, I'm still quite sure that you will have been affected by that. I think everybody is. Do we think that that is fact or fiction? Fiction, hands up.
It should be higher.
You think it's higher? Okay. it is actually fact, it is 56 billion. Bearing in mind that was 2023, so it could well be a lot higher now. Okay, a little bit sad. Those are big figures, aren't they? So, thanks for that, for participating. I'm glad that we're all still with us. I just want you to think about this question now and just mull it over for the rest of while we're talking, because hopefully if I remember or someone prompts me, I'll come back to it at the end. Right, so what kind of benefit does your company have in place for employee wellbeing? And I know if you're a small company, one-man band or 2 or 3 or maybe 5 people, it might be relatively small. But even so, have you got anything in place? So have a little think about that and we'll come back afterwards, if that's okay. Yeah? Don't just take our word for it. A couple of quotes there. Paul Droschler, he is chairman, if I can remember, of the International Chamber of Commerce. He's also chairman and was CEO of Waits Construction, big family business in construction. Good health is good business. I think that's a really nice, simple quote. And an ounce of prevention is worth a pound of cure. Benjamin Franklin, one of the American founding fathers. Not too sure he'll be too impressed with what's going on over there now, but anyway, he is there. But thinking about that, prevention is better than cure. So thinking about people's well-being is better than the cure. Just a few little, I'm not going to read them out because you guys can read, can't you? And I know you're all awake. But just a few things to think about. So it's not just mental well-being and just burnout, is it? You know, there's an awful lot of things. Eyesight, who gives that some thought? So I'm going to hand over to Stephen to do a little bit of talking now about who we are, what we do.
Thank you. You saying it?
I'm saying it.
Oh, okay.
Why do you want me to press the button?
No, it's okay. I can press buttons.
Okay.
Yeah, don't just take our word for it though. These are just some of the companies that we're currently working with. We work with about sort of 850 clients all over the company, all over the country. Okay, and that's supporting businesses from 2 employees up, either with a cash plan, either with a bundle scheme, and I'll briefly touch on what that looks like later on. Okay. So some big companies there that we work with, but we may not work with everybody. I know we work with Walsh. Where's Rain? Hello. I was going to jump. I was going to pounce on you in a non-sexy way, obviously. Just later on, but just to kind of just ask you, for your feedback, because I know you have pay care at your organisation, don't you?
Yeah, definitely. We think you're great, to be honest. A lot of the team find you really useful as well. It's the silly things, isn't it? I think things that pay you off when you've got to go and get your eyes tested or you've got to pay for your dentist or whatever it is. These guys are fantastic for it, to be honest. We claim it back. I've never heard of anyone come to me and moan that they haven't been able to claim it back, which again, amazing news because we've had that in the past. Yeah, can't see me praising.
Pay you after.
It's no problem. Thank you. See you soon, guys.
And that is essentially what we do. We're a health cash plan provider, and trying to explain that either on a one-page document or in a PowerPoint presentation can be really difficult sometimes. So if you are interested in learning a little bit more about what we do, about what Pay Care do and how we can maybe support you, or somebody that you may know, that's about what networking is all about today. I personally, I picked up a new tip last week at a networking thing. One of my colleagues was writing down every single person's name. And I was like, why'd you do that? I said, because we get a delegate list. He was like, I know, but as I'm writing it down, it sinks in a little bit more about what that person does. And just doing that and just kind of sharing that sort of knowledge with other people. So that's kind of what I was doing this afternoon. I was writing down people's names, what they do for a business. Because actually I know that me as a person, if I can share that little bit of information about, I can't do that, but I can put you in touch with somebody that can provide, cover for football groups and things like that. It's a great way of just sharing that sort of knowledge about what networking is all about. So, as mentioned, there's some companies there that we do work with. Oh, no, I can't push the button, Sal.
No, you sacked. You didn't need me to press the buttons.
Done.
Other way.
That way.
There you go.
Super. So, what sort of things are happening in your business? What sort of things are we struggling with? We also struggle. We're only a small business ourselves. As I mentioned, we've got about sort of 850 corporate clients that we work with, but we're only a company of 30-ish or so people, okay? We kind of were growing, we kind of increased our numbers because we even bought on our cleaner and kind of got our cleaner as part of our little contract. So it's just the little things that we do. We are a not-for-profit organisation, which means that we don't actually need loads of money to survive, and that's kind of worked for the last 150 years. So by us being able to kind of give money back either through a sponsorship or kind of maybe giving it back through optical claims and dental claims, as Ray mentioned, Raina, sorry. I was talking to a Ray earlier actually. So as Raina mentioned, that's kind of what we do. We give you money back for going to the opticians, going to the dentist. Not many people enjoy giving money to the opticians or dentists. No, I certainly don't. And that's kind of where a health cash plan can really jump in and help you out, or your employees out. Okay. Sally, is this one you?
That is, oh, well, it can be.
Go on.
Really stupid question. Well, I'll put you the answer there, so that wasn't great, was it? That was the stupid part. Coffee and a croissant. How much does it cost you? Who's been to Costa recently? Wild guess?
Just a wild guess, yeah.
Okay. £7.05. Yeah, absolute spot on price to you later. Wow. Who put the presentation together? I don't know. Anyway, yeah, so there you go. It costs £7.05. There is some reason about this, obviously, because Stephen's going to explain in a second, but you know, that's a fairly hefty amount of money, isn't it? Stephen's going to tell you now what you might do with less than that a month.
Yeah, because a health cash plan costs considerably less than what that does. So the cost of a coffee and a croissant, which would cost you £7.05, a health cash plan costs you £5.41 as a starting point. Okay, it can start from £2 per employee per month. That's our bundle scheme. And again, that's offering you access to GP services, it's offering you access to mental health support, it's offering you access to a discount scheme as well. So it's starting from just £2 per employee per month. So again, when you're kind of looking at your own wellbeing strategy, things like that, that's where Paycare is really there to kind of support you with it.
That's definitely your slide.
This is definitely mine.
Yeah.
Okay. So what is a health cash plan? It kind of embodies all of these sorts of things really. So we've kind of got giving that money back for the optical dental, as I kind of mentioned. My Pocket GP is giving you access to book an appointment 24/7. Okay. We all know about what that struggle is of kind of getting up first in the queue at 8 o'clock in the morning. This is something that we introduced nearly 10 years ago into our plans. So it's, you know, we're not big in terms of what we do. There are other health cash plans that are out there. There's only 10 of us in the country. So we're your local one, we're your Shropshire one, we're your Black Country one, we're the only ones that are in those sorts of areas. And when we are kind of working together and kind of recommending other companies and recommending each other, we're hoping that, you know, Paycare may just be able to be that one that you recommend. I know Emma's kind of trying the hardest site you ever, bless you.
I am, yes.
Oh, thanks.
I see the value in a big store, especially from a HR point of view. So if you've got an employee, they're off sick all the time, can't get in to see their GP, they need physio, there's a 6-month wait for it, or they've got mental health issues, but there's a waiting list for 18 months to see talking therapies. This is just some way you can signpost them straight away to get the assistance you need to get back to work or get them on the road to recovery.
Thank you. We'll also pay you later as well for that. You should have turned the camera that direction. You don't want to really over to Emma.
Got some mystery shoppers in the room.
As I mentioned, we're a not-for-profit organisation, so we don't actually need all that money to kind of survive. Is this you?
Yeah.
Hopefully.
Sorry, let's put him in his place, I think. No, I didn't mean to do that really, but simply because I'm the partnership manager at Paycare, so actually the monies that Stephen said that we give out to the community for all sorts of different causes, I'm the one that tends to go out and be the relationship manager with them, and it's been an absolute pleasure over the last 6 years to sort of connect with some unbelievable organisations, charities. So we've done some work for, a lot of work for the Haven. I jumped out of a plane for the Haven, which was interesting. We've done work with the Good Shepherd. Obviously, we're absolutely delighted to sponsor Darlaston and had a long standing relationship with them. We have a long-standing relationship with the Walls Foundation, and if you've never looked at what the Walls Foundation do, please do look them up. They are an incredible organisation, as is the Haven. We do some volunteering, and it might be that we don't, it's not all about giving out money. Some of it is. Some of it is about giving out services, some is about our support, our being able to promote your businesses, but also volunteer days. We do a lot of work with volunteer days, so we've done stuff with the Black Country Food Bank, the Haven, just all sorts of things, Ironbridge Museum Gorge, those sort of things. So yeah, being a not-for-profit organisation really sits comfortably with all of us that works there really, and that's what we're really proud of, because we do give what we make back to the community. Sorry, that was really rude.
No, it's okay.
Right, okay, I think we've had our time, but just thinking, and that was a real whistle-stop sort of tour through it all, and we've got lots of brochures here if anybody wants to take one. Obviously you can get in touch with us, you've got cards, you know where we are. So just going back to that question about what kind of benefits does your company have in place for either for yourself or for your staff, however big or small you might be. Anybody want to volunteer an answer on that? Go on, go for it, Emma. Go. Yeah, anybody want to tell us what you have or haven't got? Go on then.
Yeah, we had
The bank.
Vitality through the bank, which we've
Private
recently
health.
sacked off.
Yeah.
Because it was rubbish.
Okay.
We've gone to Bupa, which so far so good.
Okay.
A little bit better.
So you're offering private health insurance for your.
Private health insurance,
Okay.
absolutely, yeah. But it did come with a few of those kind of bells and whistles as well in terms of the
Indeed.
dental cover and all of that kind of stuff as
Yeah.
well. So
Yeah.
it's honestly, I find it invaluable.
Yeah.
But obviously that's at more of a corporate level. If we were a bit smaller and just purely West Midlands based, I think.
And that is the thing, because private health insurance used to be a really big perk, didn't it, in days gone by. When in the 80s, when I started working, we had Bupa as well. And we're a little bit of a middleman now, aren't we, really, between the NHS
Sitting in
and
between private
and private health,
yeah.
because of the expense and because of what, you know. So this is kind of a bit of a halfway house for the small, medium-sized companies that can't necessarily afford to go that way. Anybody else want to share what they do or don't have? Yes,
Well, I've got more of a question about the funding of it. So in other words, who pays? Does the employee? Does the employer? Or is
There's
it
a couple
shared
of
costs?
there's a couple of options available. We've got an employee scheme, so our members can pay for that. So companies like Walsall Council, Wolverhampton Council, Dudley Council, they're all on board with that. And members are paying for it each month out of their wages, and that allows them to claim that money for going to opticians, dentists, professional therapy, and so forth. We also have our company paid plans as well, and that just starts from anything from 2 employees up, moving into the health cash plan side, which is from 5 employees up.
So
that can either be company
either way,
paid
really,
or
yeah.
employee paid.
Anything else on? Anybody else want to share what they do? Anybody not got anything in place or not even thought about it?
Apart from
Yeah.
playing golf.
Apart from playing golf,
That's
it's probably
mine.
quite good. Yeah? No? Thought about it?
If you've got no idea, it's generally not.
Even if you're a one-man band, it's really important. In fact, I would say especially if you're a one-man band, it's important to think about your well-being because it's likely to be in a stressful time, isn't it? So that's us. That was a bit of a whistle stop. Maybe not that sexy, but hopefully a little bit sexy. I mean, Neil's disappeared. Look, he knows obviously what we do. But yeah, we're here. If you want to talk to us,
I was going to ask, does it cover anything that's previously happened and it
So-
comes back?
Yeah, so our company pay plans waiver any pre-existing medical conditions that you have. If it's an employee-funded one, then there's just a 2-year declaration apart from that point. And that just affects things like hospital cover and specialist consultations. But in terms of immediate access to dental, optical, professional therapy,